Hey everyone, welcome to the Powered by Iron Health podcast. Today we're talking about one of my favorite subjects, leadership, specifically leadership in the medical field. So before I dive into that, I will say our vision is to create a community that raises the standard of health and wellness. There is a lot out there that is about the bottom dollar, and sadly, that is the medical field. It's becoming more about that. So the ideal situation is to raise the standard. That means everyone has to raise the standard, including you as the consumer, us as the providers. Raise it up. If one of us raises, like everyone will raise. So leadership. I always talk about leadership, and I think it's the most important thing. Over the last couple of years, I have dove specifically into learning how to be a better leader for my team and for myself. And as that process has been going on, I've noticed that the medical field really has a need for leadership and leadership education on how we can empower people, whether they are our providers, whether they are our clients. So the basic tenements that I want to touch base with on today is how to use your language to make sure you're going in the right direction, how to appropriately use accountability, how to be your biggest advocate, especially in the medical field. So we'll talk about being an advocate first. What do I mean by that? I always say it, and I'll say it again. Medical field right now is a big business. PTs, we go to school for a long time. We come out not knowing what's up, what's down. We don't know how to bill insurance companies. We don't know how that process works. We don't know what or how we deliver the best quality of care appropriately. So it has to come from us as professionals to take it to the next level. When I was in school, they would always talk a lot about Vision 2020, right? So physical therapists initially started as a bachelor's degree, then it went to a master's, then it went to a doctorate degree. Right now it's all doctorate degree, which is with undergrad, 7 years of school. The education is massive, okay? The whole concept was that direct access will allow people who hurt themselves on the street to come to us for guidance and get them better prior to seeing a surgeon or getting an MRI. That vision that was sold to us is not truly at its fruition yet. And that's because of us as providers, us as the PTs, as physical therapists. We need to be the ones that are out there educating the public and taking ownership of that, saying, hey, like, this is what we do, this is who we are, we have the ability, we have the knowledge. I think they say that the second most high profession that can diagnose an orthopedic injury is physical therapists, only second to orthopedic surgeons. That's a pretty amazing thing. So you get someone who comes in who sprained their ankle or had a fall on their shoulder. We have the ability to say, hey, this needs more medical intervention, or we can fix this. So we have to be our biggest advocates. The medical field keeps getting bigger. Insurance companies keep trying to squeeze it. So if we're not advocating for ourselves, we're not saying, hey, this is who we are, this is what we deliver, it's going to keep happening. So I challenge everyone to come out. We have to rise together to do this. Be your own advocate and understand the value of physical therapy. What we do deliver is amazing. And I see it a lot with new grads, and it could be also a lack of education in the school system. And that comes down to, are we educating people how vital and how empowering our profession really is? Because we need to have the value coming out of PT school. And sometimes it is missing. It's a lack of confidence in their skills and abilities, but we should still value who and what we do and as a profession. And that starts with us. We have to start at that base level. So I challenge anyone out there to be an advocate for the profession and have confidence in what we do and own it and live it so that everyone else can feel it. It's the easiest way to do it. Easier said than done. It takes courage, it takes confidence, but we have to do it, because if not, the profession is going to keep going down. The second one is levels of accountability in the medical field. So something to note, this is very common. What's happening with physicians and other practices is a lot of these clinics are having numbers or specific numbers that need to be hit on a daily basis, whether it's prescriptions, whether it's patient seen, et cetera, right? And there's levels of accountability baked into what they do and how they offer things. Now, the shift that we're seeing is going to be outcome driven. So like, how well can we get someone better? How well can we help more people? Like the accountability is so important. Like, are you getting someone better who's in pain? Are you seeing enough people to actually make a difference? Right? That's important too. And then are you accountable to your managers and your leaders? Right? Accountability is, the more I do this, I realize is the hardest thing across the board, because people are very fearful of hurting feelings. But accountability is the right, as you as a provider, to your management team, to your boss, and to your clients, you're giving them the ability to rise to a standard that you're putting on them. If you're not doing that, you're actually doing them a in service. That's what I say. It's not a good service. If you're not helping someone rise to the next level of themselves, you're doing a disservice there. So the last one we're talking about is language, how you use your language, what you say, and what you think matters. And this falls into kind of the category of developing as a person. But I think it's so important, especially with our clients and you as a profession. What you say truly matters. Like, for example, we have instances here where if someone doesn't want to pay for a service, it's like, oh, they don't want to pay or they don't have the money. It's like saying something to that minor. Yes, it's one example, but that matters drastically, because now you're putting a lens on how you see things and how you offer things. So it's so important to understand how your language is on a very specific level, because language truly matters. It's just like if you were to have, as a PT, we'll bring this clinical, you have someone who's in chronic pain who's saying, I'm never going to get out of pain, or I'm going to need surgery to get this better. Guess what's going to happen? They're going to get surgery, because their language completely matters. There's so much research on saying, like, what you say really matters. It's you can even call it the positive affirmations or whatever, but it's so true, because you're actually training your brain to think a different way. It's perception. How do you perceive things? And it's so important, if you want to be a leader and step into a leadership role, you're watching your language and you're very diligent on how you say things, because that is coming across as how you operate. So every little thing you say is super important. It's a key to leadership anywhere, whether you're in medical or any other field. What you say truly matters. So take a mental note of when you catch yourself saying something that is not empowering you or empowering someone, because that is going to matter. So bring that to your offices, bring that to your clients, and be a leader, and let's get after it together. Thanks for watching.